All right. So you're back again with us on the deep dive. Ready for more, huh?
Well, today we're diving deep into something pretty important. Something that I don't know about you, but it's definitely made me think twice
Yeah,
about some medications I've taken before.
absolutely.
We're talking about antimicrobial drugs, you know, antibiotics, antifungals,
Right.
all those things we rely on to fight infections.
Hmm.
But, we're not just talking about how well they fight those bugs, we're looking at the other side of the coin.
Yeah, the potential downside.
Exactly, the stuff they don't always tell you in the pamphlets, right?
Right.
So we've been digging into research on the toxicities and all the crazy side effects that can come with these drugs. And let me tell you,
It's a lot to unpack.
it's a lot, but don't worry, that's what we're here for, right?
Yeah.
To break it all down, make it clear and simple, give you the need-to-know info without
Without getting too lost in the weeds.
Yeah, because it's fascinating, really, how these drugs, these tiny molecules designed to target microbes, can end up having such a range of effects on our own bodies.
It's wild. I
Yeah.
mean, some of it's pretty straightforward, like how some drugs can directly impact specific organs.
Yeah, direct organ toxicity.
Right? Like I was reading about the kidneys, how some drugs can really do a number on them, like
Oh, like the aminoglycosides?
yeah, those like gentamicin and tobramycin, those are big ones.
Those are some of the classics, vancomycin 2 and amphotericin B. Those can be pretty tough on the kidneys.
Yeah, and the thing is they can build up in those kidney cells, and that's when the damage really starts to happen.
Yeah, and it's because those aminoglycosides, for example, they have a positive charge, and that can make them bind to the cells in the kidneys, and it causes problems.
Wow, so it's like a chemistry problem, basically.
In a way, yeah, it highlights the challenge of designing drugs that are so specific to their target, the pathogen.
You want them to kill the bad guys, but leave the good guys alone.
Exactly, but sometimes there's collateral damage.
It's like a delicate balancing act, isn't it?
It really is.
And the kidneys aren't the only ones taking a hit, right?
Yeah.
I mean, the liver can have problems too, right?
Absolutely. The liver's involved in metabolizing so many things, so it's a common target.
Makes sense.
There are a bunch of drugs that can cause issues there, ranging from, mild enzyme elevations to more serious problems.
Oh, wow.
Yeah, things like erythromycin, Estilate, isoniazid,
Hmm.
and then some of the antifungals, the azole antifungals, they can all cause a range of liver problems.
It's crazy how even our ears are at risk, right?
Oh, yeah. Ototoxicity, that's a big one, especially with certain antibiotics.
The ones we were just talking about, right?
Yep. Amylglycosides and vancomycin, they can both affect both hearing and balance.
And that's scary because that damage could be permanent, right?
That's right. Unfortunately, in many cases it is. It can affect the cochlea, which is responsible for hearing, and the vestibular system, which is involved in balance.
So you could be dealing with hearing loss or vertigo or both.
Yeah, it's a serious consideration.
You know, another thing that surprised me is the impact on bone marrow.
Oh, yeah. Bone marrow suppression can be a real issue with certain drugs.
It's like they're affecting the body's ability to make blood cells, right?
Exactly. And that can lead to problems like anemia or a low platelet count, which can affect clotting.
Wow. So that's why they always want to do blood work before.
Absolutely. Monitoring is key with these medications.
So what kind of drugs are we talking about here that can cause these problems?
So some of the culprits include chloramphenicol, although it's rare with that one,
Hmm.
but it can cause a very serious condition called aplastic anemia.
I've heard of that. That's when the bone marrow basically shuts down, right?
Right, it's very serious. And then there's linezolid, that one can cause reversible thrombocytopenia.
Say that again?
Thrombocytopenia.
Thrombocytopenia. Okay, so what is that?
Basically, it means a low platelet count, which can lead to easy bruising or bleeding.
Mhm.
And it can also cause anemia, which means a low red blood cell count.
So you're basically more susceptible to infections and bleeding.
Exactly. And then there are the sulfonamides. They can also suppress bone marrow function.
So it seems like a recurring theme is that you really have to weigh the benefits of these drugs against the risks.
Absolutely. It's a risk-benefit analysis every time.
And we can't forget about the nervous system, right? The brain and nerves.
Oh, right. Neurotoxicity, that's another big one.
So what can happen there?
Well, some drugs can cause dizziness, confusion, even seizures.
Yikes.
Yeah, some of the aminoglycosides, the fluoroquinolones, linezolid, even penicillins at high doses, they can all have neurological side effects.
Penicillins. I always thought those were pretty safe.
They generally are, but at high doses, especially in people with kidney problems, they can increase the risk of seizures.
The plot thickens.
And those fluoroquinolones, they've actually got a warning about potential cartilage and tendon problems.
Really? I didn't know that.
Yeah, it's one of the reasons why they're generally avoided in children and during pregnancy.
So it's not just about immediate side effects, it's about long-term effects too.
Exactly.
It's wild to think about how these drugs can even impact developing tissues.
Yeah, tetracyclines are a good example.
The ones they use for acne, right?
Among other things, yeah. They can cause teeth discoloration and affect bone growth if they're used during pregnancy or in young children.
So it's really important to be mindful of who's taking these drugs and when.
Absolutely. It's all about timing and the specific patient group.
You know, we've been talking a lot about these direct effects on organs and tissues, but what about the immune system?
Oh, right. We can't forget about allergic and hypersensitivity reactions.
Yeah, those can be pretty scary because they're often unpredictable, right?
They are. They're immune mediated, so it's not always a dose dependent thing.
So you could have a mild reaction one time and a severe one another time.
Exactly, which is why it's so important for healthcare providers to be vigilant.
So what are some of the usual suspects when it comes to these allergic reactions?
Penicillins and other beta-lactam antibiotics are common culprits.
Beta-lactams, those are like cephalosporins and things, right?
Yep, exactly. And sulfonamides are another common trigger.
So what kind of reactions are we talking about here?
It can range from a mild rash to something much more severe, like Stevens-Johnson syndrome or toxic epidermal necrolysis.
Those sound terrifying.
They are. They're very serious skin reactions. And then, of course, there's anaphylaxis, which is a life-threatening allergic reaction.
Yeah, that one's no joke.
And one more thing to keep in mind is that there can be cross-reactivity between similar drugs like penicillins and some cephalosporins.
Oh, so if you're allergic to one, you might be allergic to the other.
That's right.
It's a minefield out there. You know, I was reading about this thing called red man syndrome, and it sounds pretty alarming.
Oh, yeah. Red man syndrome, it's actually associated with the vancomycin infusions.
Vancomycin, that's the one that can be tough on the kiddies, right?
Yep, that's the one.
So what happens with this red man syndrome?
Well, it can look pretty dramatic with flushing, itching, rash all over the upper body.
Wow, so why does it happen?
It's actually due to a rapid release of histamine, which is a chemical involved in allergic reactions.
So it's kind of like an allergic reaction?
In a way, yeah. But it's usually not a true allergy to the drug itself. It's more about the rate of infusion.
Ah, so if they give it too quickly.
Exactly. That's when you tend to see the reaction.
So how do they prevent that from happening?
Usually slowing down the infusion rate does the trick, and sometimes they might give antihistamines beforehand.
Oh, okay, that makes sense. So I guess it's usually not too serious then.
Right. It can be uncomfortable, but it's usually not dangerous.
That's good to know. So we've talked about some pretty serious side effects, but what about some of the more common ones?
Well, one of the most common complaints with oral antibiotics is gastrointestinal upset, things like nausea, vomiting, diarrhea, abdominal pain.
Yeah, I've definitely experienced that before. I always thought it was just me.
Oh, no, it's super common. There are a couple of reasons why it happens.
Like what?
Well, sometimes the drug itself can directly irritate the lining of the gut.
Ah, makes sense.
And then the other thing is that antibiotics can disrupt the normal balance of bacteria in the gut, what we call the gut microbiota.
Dysbiosis, right? I've heard that term.
Exactly, dysbiosis. And that imbalance can lead to all sorts of digestive issues.
That makes sense because those good bacteria are important for digestion, right?
Absolutely. They play a huge role in breaking down food and keeping things running smoothly.
So when they get wiped out, it's like a domino effect.
Exactly.
So is it just those good bacteria that get wiped out, or?
Well, sometimes the disruption can allow for the overgrowth of harmful bacteria.
Like what?
Well, one example is Clostridioides difficile, or C. diff.
Oh, yeah, I've heard of that. That's a nasty one.
It is. It can cause severe diarrhea and inflammation of the colon.
That's the one that can be really hard to get rid of, right?
It can be, yeah. And it's often associated with broad-spectrum antibiotics, the ones that kill a wide range of bacteria.
So are there any specific antibiotics that are more likely to cause that?
Well, clindamycin's a big one, and then the fluoroquinolones and some cephalosporins can also increase the risk.
It's like for every good thing they do, there's a potential downside.
The trade-off, for sure.
You know, another thing I remember from taking antibiotics is that warning about sun sensitivity.
Oh, yeah, photosensitivity, that's a real thing with certain drugs.
Like which ones?
Tetracyclines are a big one, especially doxycycline.
Yeah.
And fluoroquinolones can also cause it.
So you have to be extra careful about sun protection.
Absolutely. Sunscreen is a must.
So we've covered a lot of ground here, from kidney problems to skin reactions to gut issues.
And we can't forget about the heart.
Oh, right, the heart. What happens there?
While some antibiotics can actually affect the heart's electrical activity.
Really?
Yeah, they can prolong the QT interval, which is a measure of how long it takes for the heart to recharge between beats.
And that's bad because
Well, if the QT interval gets too long, it can lead to a dangerous heart rhythm problem called torsades de pointes.
that sounds serious.
It can be life-threatening.
So which antibiotics are we talking about here?
Some of the macrolides, especially erythromycin and then the fluoroquinolones, can also cause this problem.
So it's not just about choosing the right antibiotic for the infection, it's about considering the patient's overall health and any other medications they're taking.
Exactly. It's about minimizing the risks as much as possible.
So it seems like the takeaway here is that while antimicrobial drugs are essential for treating infections,
Absolutely, we rely on them heavily.
we also need to be aware of their potential downsides.
And it's not just about being aware of them, it's about actively considering them when making treatment decisions.
So I guess the question is, with all this complexity, with all these potential side effects and drug interactions, what does that say about how we approach antibiotic prescribing?
That's a great question, and I think it highlights the need for a more individualized approach, one that takes into account the patient's specific needs and risks.
So it's not just about picking the strongest drug. It's about picking the safest and most effective drug for that particular person.
Exactly, and it also underscores the importance of ongoing research and a better understanding of how these drugs interact with our bodies.
It's a constant learning process, right?
Absolutely.
Well, I think we've given our listeners a lot to think about today.
I hope so. It's important information.
Absolutely. And if you're out there listening, we'd love to hear your thoughts. Have you had any experiences with antimicrobial side effects? What questions do you have about these drugs? Let us know in the comments. And as always, thanks for joining us on the Deep Dive.
Thanks for having me.